Hello, this is Matt at CoverNow.com. Today we're going to talk about the good, the bad, and the ugly of HSAs or health savings accounts. Now let's talk about the bad parts of an HSA. Compared to a traditional high deductible plan, you're going to get coverage in front of your deductible. By that, I mean things like your office visits, your checkups, your prescription drugs. A lot of those things will be covered without having to hit your deductible with just a copay. On an HSA, the only thing that's covered in front of your deductible is the annual checkup. You do not get prescription drug coverage in front of your deductible, or if you took your child to the doctor because they had a cold, flu, sniffle, you'd be paying that out of your savings account if you pre-funded it. And what we found is some people either forget to fund that account or they're not familiar with the process. What happens on an HSA is you have the high deductible health plan that is HSA qualified. That gives you the opportunity to, in addition to that, go to the bank, start an HSA savings account, and then they'll give you a debit card that's attached to that account. And you need to put your $3,000 a year in there for an individual. You don't have to, but if you don't, what happens is your child gets sick, you run to the doctor, you give them your medical card, nothing's covered, and you feel like you're paying a lot of money for something, but you're not getting anything out of it. And so to just summarize it, years ago there was a larger spread in the cost between HSA and a traditional high deductible plan. Now there's not, and a lot of that has to do with the Affordable Care Act and the fact that there's no limits now on benefits. You could have a $10 million surgery and there's no cap on your benefits. So now the spread on costs is really just on the lower beginning side of the plan, to where you look at what is your deductible and what's your out-of-pocket max. And they're going to be fairly similar, within a few $1,000s between an HSA and a high deductible traditional health plan. So the downside is simply, if you don't fund that savings account, you're pretty much paying for everything out of your checking account or your other savings account when you go and use it. And a lot of times that frustrates people because they feel like they're paying all this money for this insurance and they're not getting anything out of it. So in short, what's the bad part about an HSA is if you're not funding that savings account, you're going to be in for a rude awakening whenever you have to go and pay for your medical bills out of pocket.